our first introduction, Olivia.
Hello, everyone. Thanks for hopping on our info session today and for your interest in ripples. My name's Olivia, and I am the Interprofessional Education Coordinator within UNC-Wilmington's College of Health and Human Services and Community Engagement and Health Equity Office. And I also serve as the Ripples Champion for our UNCW folks.
I'll introduce myself. My name's Emma Brinkmeyer. I'm the program coordinator for UNC Rural at UNC-Chapel Hill. So my work is all about supporting programs that strengthen rural community campus partnerships. Part of that is working to support Ripples.
Thanks, Emma. And hey, everybody, my name's Adam, and I serve as the director of UNC Rural. And UNC Rural helps manage the RIPPY and Ripples programs. And I've been with UNC Rural a little over 3 years now. And our broader mission is trying to connect the University of North Carolina to rural communities and partners and build and strengthen those partnerships. Very glad to be with you all today. Also wanted to go ahead and quickly introduce a couple other folks. Dr. Ash Walker will be joining us a little later, and Dr. Walker is a professor of kinesiology at UNC-Pembroke. Some of you, if you go to UNCP, you may know Dr. Walker, and he serves as the RIPPY champion at UNCP and teaches a variety of courses there and has been very engaged and instrumental in growing this program at UNCP through last year into this year. And then last but not least, the principal investigator for the RIPPY program and really who helped get the program founded along with others is Dr. Meg Zomarodi. And Meg works with us here at UNC-Chapel Hill, and she does a lot of work around interprofessional education and practice. And so is engaged in many different facets of that work between both UNC and UNC Health. And she will be actively involved with this program as we move into the summer. So just to give you a little bit more of an overview. So the Ripples program is part of RIPPY, as we mentioned before, the larger interprofessional health initiative. And RIPPY was established in 2017 through funding by the William R. Kenan Charitable Trust. And the goal of the program is to address increasing rural workforce needs in North Carolina through interprofessional collaboration opportunities in rural communities, where healthcare professionals and students work as a team to implement population-based interventions to improve care. As Ripple scholars, students will engage in activities that provide exposure to rural health through classroom activities, presentations, events, and intentional interprofessional immersive experiences. And we'll talk a little bit more about what all that means here in just a moment. So going on to the next slide, here in North Carolina, some of you may be aware of this, but 87 out of our 100 counties have, for example, primary care provider shortages. And unfortunately, there are rural health workforce shortages kind of across the board here in the state of North Carolina. For example, 90 counties lack the adequate number of mental health providers, and 76 lack the adequate number of dental providers. And so you can go on and on down the line, and unfortunately, these shortages exist. The reasons for this workforce gap are multifaceted and complex. It's interesting because this is a problem that lots of people talk about and have been talking about for a long time, but the truth is to find solutions has been really tough. But lack of education about and exposure to these rural experiences make it difficult to recruit healthcare profession graduates to rural communities. And we've learned that a healthcare professional's desire to practice in a rural area is most of the time or a lot of times predicated on growing up in a rural area or having a training experience in such a community. So again, having that exposure to rural areas is key. RIPPY aims to bring together students who have a passion for working in a rural community to form an interprofessional cohort, building community with other students while also giving back to rural areas. So our next slide here talks about the fact that while Ripples began at UNC-Chapel Hill, we quickly realized that we could make more of an impact on rural health if we partnered across the state. With amazing partners at UNC-Wilmington and UNC-Pembroke, we've been able to spread this model between the three schools. So Ripples will have an opportunity to learn from, with, and about students from all three institutions. So not only is it interprofessional, but it's also interinstitutional, and there's a mix of students from those three different locations. And now I'll turn it over to Olivia.
Here, thank you, Adam. So why IPE? I wanted to start us off with the definition of IPE, which Adam introduced us to. So interprofessional education occurs when two or more professions learn about, from, and with each other to enable effective collaboration and improve health outcomes. So we did just touch on a little bit of the workforce trends, but just to add to that, the World Health Organization estimates a projected shortfall of 11 million health workers by 2030. As far as practice, of course, there are changes in technologies, AI being the big buzzword there, requiring collaborative digital skills. And 71% of health systems are adopting AI, which of course that number is increasing. Looking at retention, 46% of health workers report burnout. So we're looking at, proper training. Proper training helps the workforce to better cope with the stressors they face and to support patients and peers, which is really what it boils down to. So interprofessional education is a necessary step in preparing a collaborative, practice-ready health workforce that is better prepared to respond to local health needs.
Thanks, Olivia. So now I'm going to talk a little bit more about who should apply. And obviously, if you're on this call, you're interested. And so these are just some of the primary things that we talk about. I mean, I think first and foremost, it's that desire to serve a rural community. Like, we're really looking for that with our Ripple scholars. We want folks who are interested and passionate about serving in rural areas, have a real curiosity around that, and really can see themselves committing to practice in rural North Carolina upon graduation. We understand that nobody has a crystal ball, but we really do want to try to support folks who see themselves over the long haul, potentially serving in rural North Carolina, and this being a springboard to really helping make that happen. We also are definitely looking for students who are interested in and willing to work interprofessionally and learn and engage with other professions. I mean, I think this is one of the most interesting things about Ripples and certainly the Summer Immersion Project is that you're going to be able to work with people from students that have a variety of interests in the rural health space, and that is a very unique learning and good learning opportunity. Going to our next slide here. Again, talking about, kind of what this program is all about. It's really about teamwork and collaboration. So you're going to be, working with others on your team and the RIPPY champions and our community partners. You're going to learn how to better assess community needs, engage key stakeholders, and ideas around delivering healthcare using innovative approaches. This is something that we also see as a springboard or a laboratory for innovation as we think about, the future of rural practice and the changing nature of rural practice here in North Carolina. And, as a result of all this, then this helped not only prepare students for the rural health workforce, but also provide networking and other opportunities moving forward. And so these are some of the logistical requirements, and these are very important to pay attention to those of you who are interested in applying, because these are, more or less required as part of the program. So, for example, it starts with a summer immersion, and the beginning of that is an in-person program orientation that we do in Chapel Hill from June 1st through the 3rd. And so that would be all 24 scholars from the 3 universities being in Chapel Hill for those key dates. Then we have a 6-week summer immersion experience. So this is an experience where you're going to be working with a team of others, and you're going to either be working in Robeson County or in New Hanover, Pender, the Wilmington area. And we're not saying, students are not asked to be in those areas, for the whole 6 weeks. Let me make that clear. But there will be some of those days during the 6 weeks where you will be immersed in those communities, because that's what we want. That's how students get the best experience, is learning about the community around them and participating in that really hands-on way. So, we could see students being in those areas for several days throughout the summer. And then towards the end of the summer, the last week, we're going to have everyone come to Wilmington for a day or two, July 13th, July 14th, for simulation, an interprofessional simulation activity that we're planning on doing. And so what we just want students who are applying to know is that those 6 weeks are very key in this full experience, and we really need your flexibility during weekdays, especially like Monday through Wednesday, Monday through Thursdays of those 6 weeks, to be available to participate in the program. Moving beyond the summer, because this is a year-long experience, we also hold interprofessional seminars and workshops with the Ripple scholars twice a month throughout the fall and spring semesters. And those are going to be held on Tuesdays from 6 to 7 p.m. And those are really great opportunities to do continued learning. We bring in a lot of speakers who are rural health practitioners and talk about different subjects and interests throughout the fall and the spring. And those seminars are another way to learn during the program. And then last but not least, we have some opportunities that we put out there for folks to attend rural conferences and events. And our next slide. So then again, just a couple other things around eligibility, and we'll be able to answer these questions, more specifics around these questions later here in the info session. But students need to be graduating in spring 2027 or later. So in school for the next academic year. UNC-Wilmington students are required to be enrolled in a summer session, and I'm sure Olivia can speak more to UNCW students about that. And then there are campus-specific programs that are eligible to be a part of this that you may have seen on the application, or that we can talk more specifically about related to each campus. All right, and with that, I'll turn it back over to Emma, I think.
Yep. Thanks, Adam. So yeah, as Adam said, a big chunk of this program is going to be the summer immersion experience. So it's going to kick off with an in-person orientation in Chapel Hill from June 1 through 3. So we will cover any lodging and coordinate that for the scholars who are traveling. And as Adam said, all the scholars will be participating in a hybrid summer immersion experience. The dates of that will go from June 8th through July 17th, and it'll be a mix of some in-person and some virtual. As Adam said, there will be some required travel to Wilmington and or to Pembroke. We cannot guarantee travel reimbursement in terms of mileage, etc., but we will cover any lodging expenses and coordinate the booking. The summer immersion will kind of conclude around a trip to Wilmington for that simulation experience. I know there's probably a lot of questions in everyone's mind about the details of this schedule, and we're working with our community partners right now to iron that out. Our goal is to have a schedule more firmly in place by the time that we're sending any offer letters to potential scholars so that anyone who is interested can kind of know what they're being asked to do before they commit. And the summer immersion experience, just to speak a little bit more about that more broadly, it's going to involve partnering with a rural community health partner and working on a team project. And there will also be opportunities to meet with community members for exposure to community-based needs and strengths. All right, and so to talk a little bit more about those community partners, I'll turn it over to Olivia, and then Dr. Walker has now joined us as well.
All right, thank you, Emma. So a little bit about Novant Health. Again, they are one of our valuable community partners. Novant Health is an integrated network of hundreds of medical facilities, providing a seamless and personalized healthcare experience for communities across North and South Carolina. Their award-winning expert care is supported by leading-edge technology and advanced clinical training. So we are very fortunate to have them as our community partners, and they really do just kind of serve as liaisons for other community partners during that summer immersion and throughout your Ripples experience. So with that, I will pass it over to Dr. Walker to talk a little bit more about UNC Health Southeastern.
Thanks, Olivia, and I do apologize for my tardiness. I know that my colleagues shared with you that my primary duties during the day is actually a faculty member, and I was in class, so it's not an excuse, just context as to why I am not here. Pleasure to be the Ripples champion for UNCP, and yes, one of our community partners is UNC Health Southeastern, which is located in Lumberton. It is a teaching institution, of course, part of the larger UNC Health network, but they have an agreement with Campbell University's medical school where residents come in and fulfill residency requirements that are needed to become practicing physician. This is the second year that UNC Health Southeastern has agreed to be a community partner, and I would just say that last year, it was a resounding success. And I know this has probably been mentioned, but so forgive me if I'm a bit repetitive. But with this kind of summer immersion experience, the community partners select the project that the Ripples cohort students, scholars are going to be working on. And last year, the leadership team at UNC Health Southeastern said, you know what, we really have some challenges with our cardiac service line. And really, we want to improve access to outpatient cardiac services. And there's a whole abundance of reasons as to why the patients living in this area have those challenges. And that was what the Ripples scholars were tasked to kind of figure out last summer. And I will say they did an amazing job. Of course, we provided guidance along the way. Shout out to Lindsay, who is going to be our quality kind of improvement expert to make sure that we kind of stay on task with that. But what this ultimately did was resulted in a deliverable kind of product at the end of presentation and actual recommendations that the health system implemented and actually saw improvement in outpatient cardiac workflow or access to care. And I will say on a different note that some of the hospital administrators confided in me after the fact on how impressed they were with the work that the scholars did. So it was an opportunity, one, to kind of learn about healthcare delivery in a rural community, but also an opportunity for the scholars to get to know each other because you're talking a bunch of different healthcare disciplines and to network and understand the unique challenges that exist in an area like Lumberton. So we look forward to doing it again this summer. And of course, the leadership team there will be providing us with guidance as to what project that the scholars get to tackle. And I'm going to be part of it too, and I'm going to be there to kind of help and guide and use any expertise that I can as well to kind of make sure that we are just as successful this summer as we were last. And I'm not, Adam, do I kick it back to
Yeah.
you?
Yes. Yeah. Thanks,
Okay.
Dr. Walker. And see, this, I mean, I get excited about this. So, as a Ripple scholar, you're going to have support. You're going to have UNC Health Southeastern, Novant Health, their resources, folks thinking about this. You're going to have Dr. Walker and Olivia and others from the university side, supporting you. So it really helps round out that summer learning experience. And again, amazing results have been coming out of these summer projects, which are really incredible and a tribute to the scholars that we've had. And so last summer, of course, Dr. Walker just talked a lot about UNC Health Southeastern's project, and then Novant Health. Also, there was a project there around community health needs assessment that was done, and the scholars, you're split into teams of 12 and 12 inter-university teams to work either on the Novant project or UNC Health Southeastern project. And then at the end of the summer, there is a presentation that's done to the leadership to talk about the work and the recommendations and all that good stuff. But with that, I'm just going to turn it back over to Olivia that I think is going to talk a little bit about the Novant work.
Yeah, so you'll see just a couple examples of what opportunities we had during the summer immersion for this 2025 to 2026 cohort. So you'll see here on the left, we were able to tour the Novant Community Care Cruiser. So our Novant partners were able to explain how this cruiser extends their reach outside their walls of their hospitals and clinics to individuals who find transportation to be a barrier in receiving healthcare. So we got an overview of the services offered, including preventative screenings, prescriptions, rapid tests for illnesses like RSV and flu, vaccines, nutrition counseling, and more. And then you'll also see on the right here, we also had the opportunity to tour other facilities, one being a local senior care center, where we engage with residents talking about their regularly scheduled health screenings, where health professionals come to conduct regular checkups, where they really come to them to promote health education. And then we got a tour of the facility and to see what different services they offer as well. So with that, I will actually hand it over to Leah Gillikin, who is one of she's within the 2025-26 cohort, and she can speak a little bit more about her experience in the program and the summer immersion.
Yeah, thanks, Olivia. Hello, everyone. Good afternoon. I had an excellent time in the Ripples program, which is continuing to be ongoing as we meet monthly for our sessions. We really had a great summer immersion program with our partnership with Novant Health, looking at rural disparities in care and coming up with some solutions for those problems that we identified through a SWOT analysis, working as a whole with an entire interdisciplinary team, kind of with a group as a whole, but also with kind of some subgroups as well. So I'm a doctor of nursing practice, family nurse practitioner student, but I also worked with a master's of gerontology student and then an occupational therapist student from UNCP. So I can speak firsthand to kind of the immersion program as a whole over the summer, which it looks like it'll be changing a little bit, which is great. But also the bi-monthly meetings as well, and the speakers that we've heard from that address rural health disparities firsthand.
Thank you. And now I know Dr. Walker has already spoke some about, the great work that was done with UNC Health Southeastern, but wonder if you just want to expand on that a little bit.
Yeah, well, it wasn't all work and no play. I mean, of course, the team did a great job with what they were tasked to accomplish. But part of this summer immersion experience is to help the scholars kind of get a feel for the community. And one of the things that we did that I had the pleasure of doing was, in the limited time that we had, I tried to provide a tour of the community, and so that they could kind of see what Lumberton and Robinson County was like. And we actually came here to UNC-Pembroke. We went to Luther Britt Park. They kind of got to see Lumberton. And I think this picture here, this was one vehicle of scholars, but if I'm not mistaken, this was where we needed a Dunkin' run. At some point, and everybody needs that Dunkin' run every now and then in midday afternoon, and you can see everybody smiling. We had a couple of vehicles. This was just an opportunity just to fellowship with each other, learn more about, each other's backgrounds and how everybody was actually at the end of the day contributing to the project and the task at hand, which they did a good job. So I'm sure we'll have more opportunities to do that again for this particular summer immersion experience, and it was a good time. And I think, if I'm not mistaken, not to put Zoe on kind of on the spot here, but if you wanted to say something, because I think you came with, she was brave enough to ride in my vehicle as I gave her a little bit of a tour. Is there anything that you want to say about the summer immersion experience here in Lumberton?
Yeah, just to quickly introduce myself, I'm Zoe. I am at the University of North Carolina at Chapel Hill. I'm in my second year getting my master's in public health and with a concentration in maternal, child, and family health. And I did get a wonderful tour by Dr. Walker. I unfortunately didn't get to do the Dunkin' Run, so I'm a bit jealous about that. But I did have a wonderful tour, and we went around. I remember we went just all around the community. And so it was really nice to get acclimated to the area and get to see what the infrastructure looked like and meet other people in the community by going out and then getting to go to our actual site. So they talked about earlier, we worked at the outpatient cardiology clinic. And this was really, really exciting because we actually got to go into the clinic. We had like our own little conference room, and we were just tasked with understanding why there was a leakage of patients to the surrounding healthcare systems. Like, why were people not utilizing the cardiology clinic that was there in the area? And it was really cool because we got to interview different clinic staff and really got to take the reins on, like, okay, what are the gaps and what questions do we need to get answers to? And so we just all ran off and asked a bunch of questions. And also just a lot of observing as well. I remember there's one day I just sat in the patient room or the waiting room to just see what that interaction looked like and tried to talk to a couple of patients as well to hear about their experiences. And then using all those interviews, we did a quality improvement project and we made PDSA cycles, which is plan, do, study, act. And it was really cool because we were learning actual skills and tools that helped us actually come up with clear improvements. And like Dr. Walker was saying, they actually were able to use the PDSA cycles that we created to help actually make those improvements. Some of those improvements were in making a automatic reminder system instead of them having to call, because that was just an extra burden on the front desk people to have to call people, remind them of their appointments. So that was a big one. And it was really an amazing experience. I always thought that I always had to have all the answers. And it's really awesome to have a team of people who from all different backgrounds. We had pharmacy, we had nursing, we had social work. And it was great because I realized that I did not need to have all the answers and I shouldn't have all the answers. And there were other people that were able to have those answers. And also, like, another side of that is who can ask the questions, because there was questions I wouldn't have thought to ask that maybe a pharmacy student can think to ask. And that was just really awesome, is seeing how important it is to have an interdisciplinary team and hear all the different perspectives. So anyhow, just a little bit about my experience.
Thank you, Zoe.
Yeah, thanks so much. And so, in addition to, you all just heard even more about the summer immersion experience and those projects, but as we had said too, we also have continued learning opportunities throughout the fall and spring semesters. And those are going to continue for this next cohort, of course, and those are all done via Zoom. And those have been really good, I think, and engaging. We have speakers that hit on lots of different aspects of rural health, and so that is something that's really good. And we ask the scholars too, like, hey, who are some of the folks you'd like to hear from? And we try to help make that happen. So that's something that you could also expect to continue as well. And I believe Dr. Walker is going to maybe talk about some other opportunities we have, and then we can talk a little bit more about the application process, et cetera.
Yeah, I just wanted to say these are some examples of seminar topics that we had over this past year, just to give everyone kind of a preview of kind of the variety of topics and just ways in which we further engage scholars interprofessionally. I'll pass it to Dr. Walker to talk a little bit more about additional opportunities.
Thank you, Emma. Yeah, there's an abundance, and this is probably not a comprehensive list because I will give Adam and Emma a lot of credit. They're great at finding opportunities to just kind of expand your knowledge when it comes to rural health and the delivery of rural health and the challenges associated with that. Of course, Ripple scholars are going to be asked to attend at least one rural health event or conference. And below are just a list of some examples related to what that may look like. And as you can see, there's a lot here to choose from, like health equity conferences. This could be regional or nationally. There's an Advocating for Health Equity conference. That's a virtual one. The Rural Health Clinical Conference is virtual. There's the Minority Health Conference in person. Is that, Adam, correct me, that one's actually coming up this year or this month for our current scholars, is it not, in Chapel Hill?
Correct. Yep.
Okay, yeah, and then there's other events. There's other interprofessional events, collaborative simulation events, or an interprofessional education fall fest that's in person. There's the Health and Human Services Week at UNCW. That's virtual and also in person. Bottom line is, we don't want you to think like when you're asked to attend one of these rural health events, you've got to kind of, well, I don't know what to do. We're going to help you find out what these are and what those resources are so that you're not guessing, and you can choose one or more if you would like, that you find interesting to you. So it's pretty exciting to know that we've got all these opportunities for our scholars. And Adam, do I kick it back to you?
Yeah, and I think maybe Olivia is going to talk a little bit about the tuition support, which is
Fantastic.
also something I know people will be interested in.
For sure. So as a part of our Ripples program, we do offer tuition assistance for our scholars. So this is financial aid dependent, and the responsibility is on the scholars to speak to your scholarship or financial aid advisor to ensure you're eligible for the Ripples program tuition assistance. I know, of course, this is a case-by-case basis. Everyone might have, a work study, tuition assistance, or other financial aid. So again, it will be on the scholar to speak with your financial or scholarship advisor. So tuition scholarships are dispersed through your school's financial aid office each semester. So that will total up to 10,000 divided over 3 semesters. So each semester you will be receiving a little over 3,000. So that's for spring, summer, and fall. And that will be directly dispersed to your tuition account. So when that happens, you will also receive an email that has been initiated, and then you should see that in your account, I believe, within that 24 hours. And again, I'm sure there will be questions about this, so we're happy to try to answer those in our breakout rooms at the end of our session.
Thanks, Olivia. And finally, just to go over the application process. Many of you may have seen these dates already, but we just wanted to go over them again as a group. So the application submission deadline is Monday, February 23rd at 5 p.m. The request for interviews for potential candidates will be sent in early to mid-March. We are working around each campus's spring break to coordinate that. We also then will be conducting 30-minute, I believe, virtual interviews sometime in mid to late March. And then our plan is to send offer letters by early April. And if you have any questions about that, you can contact me, and that's my email address. So I know we have a smaller group. I don't know. I hope no one had any trouble joining the Zoom. I saw some re-registration emails come through. So apologies for any technical difficulties. Since we do have a smaller group, one option I think we were thinking is we could just stay together as a main group and answer questions kind of as this larger group. I know Olivia has some slides that she can share about UNC-Wilmington specific requirements. I have a couple things I can say about Chapel Hill, and Dr. Walker can say a couple things about Pembroke. And we also have our current scholars here as well who can maybe offer some thoughts about, the program as a whole and any kind of advice they might give or just what has stuck out to them over the course of their experience as a Ripples scholar. So I thought maybe we could start with the current scholars to put you back on the spot for a moment. So Leah or Zoe, if you wanted to just say a couple words about your experience and what has stuck out to you, or if you have any words of advice for potential applicants.
I'll go first, Zoe, unless you have something to add right away. I just want to say how important it is if you have a calling and you want to go into rural health. I'm sitting in a rural health clinic right now, in clinicals for my nurse practitioner licensure, but it's really important to make those partnerships and understand the importance of it, and community partners that are addressing these health disparities and how they're going about doing it, because it's going to be long lasting in your career in healthcare, whether you're a social worker, a nurse practitioner, a pharmacist, an occupational, health student, whatever it may be. It's the way to truly identify what is going on and how are we fixing these problems that have been around for a long time, but continue to be an issue. So I've been extremely grateful to be a part of this because I've seen it firsthand time and time again as somebody who has a calling to serve in rural health. But it's interesting kind of taking a step back and looking at a student perspective of it with fresh eyes. And that's something that the Novant Health leadership team was really, really surprised about in the solutions that we came to longstanding problems. So it's an extra set of eyes and ears. And it was really rewarding and something that I'm very grateful for.
Yeah, just building off of that, this whole experience has been super, super rewarding getting to talk with other students. Like I said, I just like never really saw just how amazing it is to have people from different backgrounds and different ways of thinking on your team, and having those perspectives, it made me think bigger too. Like I now can understand like I feel like something that's really important is knowing who to turn to and who to ask. And being on this team, I have learned, okay, I don't know that answer, but who can I turn to that might know that answer? Or I don't know what to ask, who can I turn to that can ask those questions? And so I think that's been one of the best lessons that I've gotten out of this is how do I leverage all the different backgrounds in a group that I'm with? And how do we make sure that we're coming up with a solution that really encompasses and is holistic and can address all aspects instead of just a really siloed way of thinking. It's like, for an example, I'm public health, so I'm very, very macro. I want to think about the social determinants of health, and then I don't really think that much about what it actually looks like to, authorize insurance and how that might increase the like people leaving that healthcare system and going elsewhere. So I think that has been the most rewarding aspect of this is really seeing how important it is to have people from different backgrounds and knowing how to leverage all those perspectives.
Thank you both so much for those words. It's really wonderful to hear. I just wanted to quickly share the eligibility requirements for Chapel Hill. Let me just get that up on the screen for you all to see. So, does everyone see that? Okay, cool. So, as we've said already, everyone's graduation date has to be spring 2027 or later. At UNC-Chapel Hill, you have to be enrolled in one of these following schools: dentistry, pharmacy, public health, medicine, nursing, or social work. That's kind of the main thing I wanted to share from the Chapel Hill perspective. Adam, is there anything else you wanted to share in terms of UNC-Chapel Hill specific information?
No, not at the moment.
All right. And maybe Olivia, do you want to share what you had for Wilmington?
Sure, thank you. I can go ahead and share my screen. So it's gonna load here. So just to rehash our eligibility, so this is specific to UNC-Wilmington students. We will be required to be enrolled in at least one summer session to participate in the program, and we will have to show proof at the beginning of the summer semester of enrollment. And again, this will apply to all applicants, so graduating spring 2027 or later. And then an interest in rural health, of course. And then priority will be given to workforce ready degrees. So those planning to enter the health and human service workforce directly upon graduating. So anyone within the College of Health and Human Services, we're looking at nursing, pre-health, and of course, anyone interested in rural health and wanting to work within rural health directly after graduating. So we briefly touched on some IPE opportunities. So this will be open to our UNCW and as well as some UNC students. We have some IPE mega simulation events in the spring and in the fall semesters. Our next one is actually this coming Monday. So that will be in person and potentially a virtual option as well. For any virtual participants or guests or observers who are interested in checking out the event. So this will be interprofessional teams of students who are working through different emergency response skills. This could be stop the bleed. This could be administering intranasal Narcan or teach back and other communication tools when working with your patient or client. And then moving on to HHS week, this is also right around the corner for us. This is a series of events across, I believe, four days this week, where you can attend some guest speakers or other events that might be similar to our simulation event. So there's a large variety. This is also hybrid, so there are in-person and virtual opportunities here as well. And really just staying in the know. So we've, included our emails in here. So please, reach out or just stay in the know of any IPE opportunities available and never hesitate to reach out if there's anything you're interested in and want to get involved. And then one last thing I wanted to go over, which will be specific to our Novant or UNCW students. We do have our executive sponsors who will also provide another level of support to our scholars. So they will serve as subject matter experts and mentors. They will be engaging with our students during the summer immersion and the rest of the academic year. So there will be some virtual and potentially in-person touch points throughout the experience. We'll also connect them to our other community partners and other subject matter experts when working on your project. So I know a lot of our scholars would reach out to our executive sponsors during the summer immersion, and they might want to know who to reach out to or make that connection and send an introductory email if they're looking for some specific research or specific information that they'll want straight from the source. So they're great for building those connections and providing real world insight into healthcare leadership and our community needs. So they play a big role in our project and throughout the program. And they guide interprofessional teams and community needs assessment in their project, support student learning through virtual and in-person connections, and help shape future healthcare leaders and strengthen community partnerships. And then again, here is our timeline for everyone just to have in the back of their mind. So our application submission deadline is Monday, February 23rd at 5 p.m. And here are some other due dates. And we're looking at interviews early mid-March, which again will be about 30 minutes virtually, and offer letters will be sent by early April. And here's Emma's email again if you have any questions or comments or concerns. And please feel free to reach out to any of us as well. So here's my email if anyone at UNCW wants to reach out with any questions specific to UNCW or about the program in general. And that is just about it for me, unless anyone has any questions or anything else you want to share.
I'm so
Maybe
sorry. Will the application be is it somewhere that we can access it to fill it out?
Yeah, I can put the website information in the chat in just a moment, but yeah, there's a Qualtrics survey to submit the application, and you should be able to preview it. We have a PDF on our website, so you can see what's required before you open that file. So I'll drop that in the chat in just a second.
And do you need to be a full-time student in order to be considered for this?
Can someone speak to that, Olivia or Adam, while I get that website up?
Typically, yes, we have offered this to full-time students. However, I don't think it's not, part-time students are not prohibited from applying. It's just something that we would take in consideration as far as our selection.
Thank you.
You're welcome. Mr. Garcia, you have your hand up?
I do, thank you.
Yeah.
I joined a little late, so you all may have answered this already. So apologies for that. But I did see that there was a requirement for the UNCW students to be enrolled in summer courses. Would this be true for the other two universities as well? Do like UNC-Chapel Hill students also have to be enrolled in one of the summer semesters?
No, it is not a requirement for UNC-Chapel Hill or UNC-Pembroke students to be enrolled in summer school. That is just for the UNC-Wilmington's cohort.
Okay, thank you.
And Dr. Walker, did you want to say anything about any information about the UNC-Pembroke requirements, or if there's anything you wanted to share?
Yeah, sure. Our requirements are very similar to UNCW's, with the exception, as Adam just mentioned, you're not required to be enrolled in a summer course. However, I will say if that is the case and you're not enrolled in a summer course, because the scholarship has to be distributed through the financial aid department here at UNCP, you would probably get the summer stipend along with your fall stipend. And that's something, if you have specific questions about, I can try to guide you in the right direction. But that's something we kind of learned last year as we were the new kids on the block, being a new site here at UNCP. But it's open to all programs within the College of Health Sciences here at UNC-Pembroke. So that's anything from nursing to kinesiology to occupational therapy, the Masters of Healthcare Administration. All those wonderful programs under the CHS umbrella are eligible to apply. But same as stated earlier, you have to have at least 3 semesters left in order to be eligible, and a strong desire to want to work in a rural community. Is it Leanne? You have a question?
Yes. How many slots are available for each cohort?
That's a great question. There are 8 students per institution, so there'll be 24 total.
Thank you.
Mhm.
Any other questions? Oh. Leanne, would you like to ask another question? Or
No, I'm just wiggling around. Sorry.
yeah, no problem.
This was a lot of really great information. Thank you.
Right. Well, I guess we'll conclude then. But again, reach out to me or Olivia or Dr. Walker with any further questions. The website that I put in the chat has further information about those campus-specific requirements, as well as just kind of an overview of a lot of the information that we shared today. It also has the application link and a PDF of the application so you can preview it before you begin. But again, thank you so much for your interest in this program and for taking the time to learn more. We really appreciate it.